Good morning. Today I will introduce two joints with you. The first joint called shoulder girdle. The shoulder girdle is not a single simple joint. It compresses by two joints. First called the sternoclavicular joint and acromion clavicular joint. The sternoclavicular joint is a sudden joint. It permits a ball and socket movement, and it can slight rotation like this. And the acromion clavicular joint is a gliding joint. It can provide some gliding movement like this. And next, it can have the six movement. The first movement called protraction, and next is retraction. And for next movement, we can have upward rotation, downward rotation, and elevation and depression. And the shoulder joint, also called glenohumeral joint, is the next joint I will introduce. The glenohumeral joint is a ball and socket joint. It has all planes of movement, and it can provide a huge mobile angle like 260 degrees, 270 degrees. So this joint can have 8 movements. First, it can have shoulder flexion, shoulder extension, shoulder abduction, shoulder adduction, shoulder horizontal adduction, shoulder horizontal abduction, and we will have shoulder internal rotation, shoulder external rotation. And here we will have some bony lemma introduced with a human model. Here is the anatomical position on the anterior surface. This bone called clavicle will have two heads on it. This one called sternal end of clavicle. This one called the acromion end of clavicle. Here is the acromion process on here, and next on the anterior surface we will have a scapula. The scapula have some bony lemmas, like here called medial border, here called the lateral border. Here is the inferior angle. Here is the superior angle. Here is the spine of scapular spine. Okay, thank you for your help. And we will introduce 3 muscles to you. This muscle called the pectoralis major. This muscle called deltoid. This muscle called latissimus dorsi. Okay, thank you for your help. And for the pectoralis major, we will have 2 different origins. The first is called the upper fiber. The upper fiber, it is the anterior surface of the half of clavicle here. The next origin is called lower fiber, and the lower fiber is the anterior surface of costal cartilage of 6 ribs here, and the adjacent portion of sternum here. And next, they have a same insection here. It's called the greater tubercle of Kurz here, and they provide 4 movements called the shoulder flexion, shoulder adduction, shoulder horizontal adduction, and shoulder internal rotation. Next, the latissimus dorsi have 3 different origins. First, it is the crest of ilium and the back of sacrum. And next is the T6 to T12 of the spinal process, and the lumbar of spinal process. And they share the same insertion of called medial lip of intertuberculum growth of humor here, and they provide some movement called shoulder extension, shoulder adduction, and the horizontal abduction and the shoulder internal rotation. And next, the last muscle is deltoid. The deltoid has 3 different fibers. The anterior fiber origin is anterior lateral third of clavicle. The lateral fiber, the medial fiber, is the lateral aspect of acromion, and the inferior fiber is the inferior edge of scapular spine. and they have the same insertion of the deltoid tuberosity on lateral humor. And they provide anterior fiber provide shoulder abduction, shoulder flexion, and internal rotation. The medial fiber provide shoulder abduction. Posterior fiber provide shoulder abduction and shoulder external rotation. Last, I will show you 3 exercises for these muscles. First, for pectoralis major, we will have wall push-up, and next we will have rubber band run arm row for the latissimus dorsi, and the last we will have rubber band lateral raise for deltoid. That's all. Thank you.